Yeah, we should. I would like that. Actually, we can put on the game.
For produced paper.
She's saying this is going to roll today.
Yeah.
Look at that. It's been rolling lately.
I know.
Like,
Right.
yeah, and it hasn't been like the.
He did that. There's one that's on left wing.
No kidding.
It's like.
I lived through those.
Oh, I know. I went to a couple.
But I never had a.
He just sat there very quietly and politely and
Yes.
and listened.
Yes.
My phone.
And that was they were trying to figure out that these alternatives
There was no way
are a win-win. If you
They-
love it, yeah. But if it wasn't you have a decision.
I was.
Made
Oh.
that one.
Yes. Before you then dedicate.
Yes.
Same.
She's like, he does. I realize. Get it.
She said that.
So that's what.
Are they?
At least I
I
could
agree.
say we made good decisions. I was on the
Okay.
and we made it. This thing.
Right.
If-
He's so pure.
Oh,
So just, we all have to be on. On our best.
It's time.
that's right.
We're good.
Stand.
You are.
Indicate.
Boy, all these things are good. Right?
Oh yeah. You're being. Stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. All right. November. Okay, if we can have our minutes approved from our last meeting. Any motion to approve?
Motion to approve.
Second.
Okay, Dr. Watson,
Yes.
Dr. Brooks,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
Thank you.
We have a full house. Good. We're all here. Okay, so the next board meeting is scheduled for December 2nd, which will be the last one of the year. No new business, no old business. Any report of board attorney?
Well, I just thought I'd take this opportunity to go through some of the provisions of SB1 from last year that go to. I'm just kidding. There's
Like, do you want me to elbow you?
I. It's 1,000 pages.
No one asked you for that. Well done, you.
And it's not even April. Not even in April.
No, that's why we're doing so good today, because we were so prepared in April.
Yeah.
Yes. Yes.
There's no legal report.
No legal report. Thank you.
Contract will be out in December.
Yeah. Looking forward to it.
Thank
Claims and receipts are going around for us to sign. I think once we get to Dr. Osan, if we can have a motion to approve our claims and receipts.
You're
I get the short bun.
All right. Can we have a motion to approve?
Motion to approve.
Thank you.
second.
Thank you.
Okay, Dr. Watson,
Yes.
Dr. Brooks,
Yes.
Michelle,
Yes.
Robin,
Yes.
Sylvia,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
Thank
Very good. All right. Reports of committee, staff, and health officer.
You guys want to go ahead and find help?
Was this?
You're the long.
Okay.
No. Short meeting.
Thank you.
Kendra passed out a report that I crafted, and it's really comparing last time, which was through the end of March, and so then I just took it through the end of October 31st, and so just wanted to point out June, July, and August. I also added return users and new users. So that's yellow on there. That's new compared to last time. we had quite an increase in users. I mean, like, I'm even
Great.
questioning it and saying, Sam, is that right? But here's what happened. We had our health fair. We had backpacks. We had our bags given out. So we had those on the table. I think the sheriff's office, Center Township, they have our magnets. And then we had open walk-ins for school for 2 weeks for Valpo and Portage. And then we had our August health and safety fair. And so I can reach out to Find Help and just kind of dive a little deeper on it, but I think that is a reflection on all the outreach that we're doing.
That's great because that was going to be my next question. What do you think made the difference? Is because that's always our challenge.
Mhm.
How do we get people to know of all the services?
Yeah.
So the outreach is
Yeah, and it's even from the anonymous users to the identified users, so it kind of matches. Especially with the big jump in June, it kind of started to gradually increase, but that was our health fair, and we heavily advertised that. And then there's some beach outreach. The nursing does so many things, and then we have Tara doing outreach. So I really believe that a lot of it is from that. I'll give props to Center Township Trustee's office.
Yeah.
Kelly is always reaching out to me for Find Help magnets. I think she is the biggest one who gives them out.
Good.
So I was really pleasantly surprised to see that because last year we were just really trying to get the site how we wanted it. Added over probably 500 programs, I think, or even more. And I also think June too, we felt more comfortable with where it's at and using it. So I'm definitely gonna ask them in our next meeting to see if they can look into it a little further that we're not seeing, and kind of because I tend to question things sometimes. So I just want to make sure I'm giving the right information.
And really, in terms of what they're searching for, it seems to be pretty consistent, though.
So it does. There is.
Housing, health.
There is.
The
Yes. So I also wanted on page 1 and looking at year to date, January through really October 31st compared to the previous year, which I don't have that exact match. We had a 105.5 increase in searches. So rather than going all of last year to only part of this year, I looked at the same time frame.
Yeah.
So really more than doubled.
Yeah.
And so that also kind of coincides with the numbers of users.
Yeah.
So it's really matching. The search I do want to mention because this year we really focused on getting some of our categories right. Things weren't populating correctly. So we had arts programs. Well, if someone had state-of-the-art technology in their card listing, it showed up in arts programs. It wasn't an art program. So we have had to go in, now that we have administration capability to add programs, edit programs, where our hands were tied before, we really focused on getting a lot of those categories updated. So I feel like some of these categories that are the top 5 are ones we were really working on.
Transit, like to me, that's so low for what we've been told.
And for me, I'm not going there for transportation because I already got my resources that I know. So
it's interesting to me whether it was summer or not. Like housing and food is still always high.
It is. It is.
Winter, I would expect that to be worse in the winter, but it's to be pretty consistent from these two graphs.
And I'm kind of anxious to see what it's going to look like in the next couple months with like benefits being cut, SNAP potentially being affected. I did do a report, which I didn't include because I just wanted to make sure it was accurate. Last quarter, the top 5 were emergency and temporary shelter, help paying for housing and utilities. Disability community did pop up there, food pantry, and financial assistance. So pretty consistent, but just because we weren't working in it so much to clear up some of the things that weren't categorized correctly. So still pretty consistent. And then I kind of just ran another, because I didn't want to I could give you pages of stuff and I didn't want to. Highest overall utilized of selected filters, most engaged the top 5 were Co-Action, Salvation Army of Porter County, Porter County Aging and Community Services, Caring Place, and Community Change Center. And I believe that's pretty accurate. Co-Action with a lot of housing assistance needed. Salvation Army, we work very closely with Bailey there. She's very much partnering and doing events and things like that. Porter County Aging with transportation and stuff like that. And Caring Place, I've recently been working with them a lot for other programs. So yeah.
Do you get to see like individually, is it what part of Porter County is using it more? Is it a Valpo? Is it a Portage? Is it a, the outskirts?
We should be able to. They have a
Out of curiosity.
yeah. That's the one thing I want to do next. And I talked with Sam. So we have our every other week meeting. Sometimes we might have to cancel. I definitely want to do a deeper dive in the analytics because we've got the site really good. So to make sure we're reporting the best information and giving that to you.
Your hard work is,
It's getting there.
this is amazing.
I'm going to share one more thing and then I'm going to let Sam talk about a couple things. Part of our outreach, we have the Find Help magnet, so we took it a step further. Porter County Aging, Sam was working with them to get something in their buses.
Mm-hmm.
So this is a big window cling that'll be for the drivers to see. I actually thought it would be a little bigger, but this is the size they wanted. And so it's got the QR code in the website, so those riding those transportation and even their newer vehicles, they'll have that in there. And then we're dreaming a little big, especially this year. And we got a removable sticker and then a window cling. We went with both options because some may not think sticker and, oh, I don't want a sticker. We want these in our business windows so that families can see them. I'm even a fan of, let's put them in our county bathroom on the window or
The mirror. Yeah.
and then we got a few stickers made. So at the baby shower, I was able to give out several of these to businesses,
Libraries.
libraries.
We have it in our veterans office, the Find Help.
We do not, but I will get it
Yeah, because
to him.
the veterans are always trying to,
Yeah.
you know.
We recently got these, so we talked about it at Community Resource Network. So that's our next step to really push this out and even ask them to start handing these out and asking businesses because they're part of it. So
Perfect.
and then Sam has some other updates. We tag team.
Yeah, I wanted to talk more about the kind of the big picture stuff. So now that the site is in a really good place with the Community Resource Network meetings, we've been able to focus on how do we keep pushing this out on a larger scale. So I can't remember if last time we were here, if at that point we had them on the bus kiosks around town or not, but now we have the QR code and the URL up on the kiosks at the bus stops. The libraries now have it on the tablets that patrons can check out so they can go to the site really easily. A lot of our Community Resource Network members now have it in their email signature and on their different marketing materials. And we're getting it to where everybody has their own ref tags. Carrie's still training a lot of people on how to use it, but eventually we'll be able to pull the reports on where people are accessing the site from on a much larger scale too. And then you saw that'll go on the buses. So now every month in our Community Resource Network meetings, we're asking for more ideas on how to keep helping our community members recognize this so it becomes more of a uniform thing. But I've seen a shift in when I started in police social work, I would at least once a week I'd have agencies reach out asking about resource guides or wanting to create their own resource guides. And it feels promising that I've seen a reduction in that. And when agencies come to me and say, what about this guide? Then I'm able to just point them to this site. And I think I know it's helping kind of increase our numbers too. And then Carrie and I are always encouraging people to, if you see a resource missing or you notice you're not on there and should be, then get it added or reach out to us. So it's definitely, it's doing what it was intended to do in terms of centralizing so we're not all pulling from 8 different guides throughout the county. And then also it has been really cool. We've seen the Find Help team actually, as Carrie said, we do the biweekly meetings with them, and we've gotten our site now to the point where they're kind of using Porter County as a model for other places. So we had Fairview out of Minnesota asked them for an example or an agency that they could reach out to and see to decide if they want to use Find Help. And so we're meeting with them here in a week or two, so they can look at what we've built and kind of use that as they create their own. So the goal was always build it for Porter County and then help that model be implemented elsewhere. So it's definitely doing that. And then we've also, I know there was quite a few kinks we were working through as we got started with this project, but Find Help we have seen really take our input, take the feedback we give them and implement it to make the site better. So recently they absorbed Keep, which is a case management and referral system software that we probably talked about last time a little bit. But we have several agencies now, including Community Change Center, that couldn't afford. Keep is given to us all for free, and for agencies like us that can't afford to pay for an expensive software, it's been game changing to be able to have one place to put all of our narratives and information. But then also, again, with the big picture, kind of like Charity Tracker, if anyone is familiar with that, that was a Unite Away project, and it sort of died out because there wasn't a lot, or I shouldn't say died out, but it was has been reduced, I would say, in the rollout. Because it was hard to get agencies on board, but we've seen such success with the resource network and with Find Help that now we're getting more and more agencies using Keep, and so it is it's encouraging to me to see the site be successful, but then also see it continue to meet the needs in other areas such as that kind of referral and case management as well. So thank you all for making it possible.
I do want to add also about Keep. So we had Dave review usage. For me in my role, I am able to use it, and it is a blessing because oftentimes I'm just getting a phone call. Hey, I'm new to the area. Can you tell me where I can find help with food or housing? And rather than what's your last name, what's your date of birth, and get all kinds of information where it might be a barrier for them to reach out, I am able to, you can use Keep and just enter their name. You don't have to have a date of birth. So I am able to document a lot of that interaction where right now I'm just doing tally marks on a paper. And the goal is to be able to give a better report to you once they get that report figured out. But it's a way for me to document everything in a big long spreadsheet. And then eventually I think we could possibly use it to get those we're helping to also use it to keep secure documents such as a copy of their social security card or driver's license that they often need because the program originally started for homeless individuals. So it's been great. Center Township Trustee had a older database program that was created for them. She is using it, and the great thing about it is it's web based. So if she's working from home, she can do her documentation. So that's just another bonus to it.
Very nice.
Well, thank you.
Very
Yeah.
incredible. I mean, this is exactly.
Thank you for allowing us to have it and continue to fund it. We just renewed for one more year, so
I think now is a good time to get it on social media again. You know,
yes,
everyone's looking at resources at this moment.
yes,
At the food pantries.
Mhm.
And, you know, every one of those places that you listed sites, all the food pantries put this out there too.
Yeah.
Those stickers at the food pantries.
Yeah.
I think everyone's looking right.
Yep, definitely. Thank you for the reminder, Demetrius. Let's schedule it.
I know you have like a list of things of how to add this in. You probably already have it. Very good. I'm proud of you guys. Thank you.
Thank you.
Thank you all.
Thanks.
We had our baby shower, and Jess is going to talk about that real quick.
We had over 100 attendees.
Wow.
6 were pregnant mothers. It was the 17th from 11 to 3. We'll do it again next year. Lots of positive feedback, and Demetrius is going to play a video.
Oh, yay.
See a little bit of what happened. Thanks for doing this. You guys are awesome.
Great.
lots of fun things for the babies too. Hot ducky. Yeah. This is so cool. I was not expecting it to have as many booths as they do, which is really nice. And it's cool that like there's like the raffles and everything. And that was really nice too. So I saw the flyer out and about, and I was hanging with my mom friend, and I was like, "You should go and just see what's up." I'm always looking for mama connections and think of that enrich our lives. Just like a nice spot for moms to go be in that environment together to feel more supported and like less alone. And so it's been cool to get a lot of information and yeah, just see what is going on in our community. Honestly, I'm like kind of impressed with how many like resources there are. And the welcome was really nice too. So I would say if you're a new mom or gonna be a new mom, just come and get all the information that you can get. You never have too much information, especially when you're brand new to this and you're trying to decide what's the best way to go. I would say like pregnant moms, I think would really benefit from this because there's a lot of information that you would get before and like a year in it's still helpful, but there's like a lot of things that like I think would have been really helpful to know prior to. It's been really helpful to see different resources and things too.
Are you making friends?
Yes.
Yeah.
Aw, nice picture.
Awesome. Well done. Incredible.
Very successful.
Very nice.
Okay, so the next video, because we're just showing videos tonight.
Good.
DL had a great idea, and he's going to tell you a little bit about it.
Okay. So, if you are unaware, August was a very bad month
Yeah.
for infant deaths in Indiana. We had close to 20 different situations where babies passed away. Dr. Weaver put out a call to action on social media. She also put out an email in the local IDOH updates for each week. I kind of thought it would be nice to do a nice PSA.
It was all safe sleep related.
Yeah, safe
All
sleep.
of these deaths were all
Absolutely.
safe sleep related.
So I took a few weeks in September and the first week of October. I went to a few different health departments and got video to kind of put awareness out there that we need to. It's a big initiative. Like I
Good.
said, August was just too
Eye-opening.
babies. Yeah,
Eye-opening,
it really was.
right?
So I reached out to 11 different entities and 8 of them responded. So got most of the people that I wanted involved in this. And yeah, I'll show it to you.
You posted this one.
I
right?
did.
I did. Yeah, this is cool. Very good.
In August, Indiana experienced a heartbreaking spike in infant deaths due to unsafe sleep environments, more than 18 in just 1 month. Normally, we lose about 2 babies per week, but these tragedies are preventable. With this recent rise, it's critical to remember the ABCs of safe sleep, so every baby can sleep safely. We're proud to join this statewide effort and remind every caregiver that safe sleep saves lives.
Just remember the ABCs of safe sleep. Alone, back, crib, every sleep, every night.
For the safety of the babies, room sharing without bed sharing is safest. Keep your baby close, but always in their own crib. Unsafe sleep doesn't just happen at night. According to the Indiana Department of Health, 36% of the deaths happen during nap time.
Following some simple steps, like removing pillows, blankets, and toys, can protect your baby.
Safe sleep isn't just for newborns. It's for every nap, for every night, for the first year of life.
We are working together to help families keep their babies safe.
Together, we can reduce preventable deaths.
Clear, consistent, safe sleep practices protect our most vulnerable. When caregivers follow the ABCs alone, back, and crib, we prevent tragedies.
The fate of Who's Your Baby rests in all of our hands. We can prevent these heartbreaking losses and give every child the safe start they deserve.
These tragic infant deaths are preventable. Every baby deserves the safest start to life. By remembering the ABCs, alone, on their back, in a crib, we can save lives. Please practice safe sleep every nap, every night.
That is really cool.
Mm-hmm.
Very well done. Very well
So
done.
the goal of it was to have something that all the health departments could really
Yes.
use, something we could just kind of feed off of each other. And Dr. Weaver came through with a nice little book.
Yeah.
And so it's not only regional, it's something we can put out state.
Sure.
So
Nice.
she really
Cool.
came through with stuff with that.
Yeah.
Very nice.
Incredible. Well done.
Okay, so one more video.
Yes. That's
Right.
hard to beat. That's hard to beat.
Right, I know. So Kendra found out about a contest, so she's gonna talk a little bit about it.
We're in a nationwide contest to win
Oh, yeah.
Roth ID tags. I don't know if everybody knows what a Roth ID tag is. They're tags that go on kiddos' car seats. This was created by Julie Roth's family. Julie Roth was in a car accident on the highway with her and her toddlers. She was pregnant. Her and the baby did not survive. The two toddlers in the back did. They were left kind of unidentified without next of kin for a very long time. So her family made this. It goes on the car seat in the event of an accident. It can be ripped off and it turns into a band, a wristband for the kiddos, and it has their emergency contacts on it. So we made it through 2 rounds of live voting, and we won 375 free Roth ID tags.
What's the dollar amount on that?
1,050. Was it 1,250? I think is what it was.
The goal was to win like $10,000.
I know, but you did good. I voted.
Thanks. So yeah, we made a video.
Councilman Bozak posted it. Yeah.
So this was our video that we submitted for round 2.
He loves that.
Roth ID tag? What's wrong? What a waste of paper.
Stop right there. Clearly, she has no idea how important this Roth ID tag is. Hi, my name is Kendall Becker, and I'm a certified child passenger safety technician here at the Porter County Health Department. This is a Roth ID tag. It's a very important first response tool that every parent should have in their child's seat. Fill it out with your child's name, date of birth, and any other important medical information, along with emergency contacts. In an emergency, it detaches from the car seat to become an ID tool. Why does the health department care about this? Because this is public health. Providing these tags supports the Porter County Health Department's mission of promoting, protecting, and providing for the health needs of our community. This tag helps first responders save precious time and identify children when parents cannot.
I know a great way to get these out to the public.
At the Porter County Health Department, our mission to make sure that every child is riding safely every ride with a Roth ID attached to their car seat. We offer car seat fit checks where you can bring your child and car seat in, and we can get your child for the car seat, and you can leave with a Roth ID tag. We also give Roth ID tags away in our battle records department with our new baby badge. We work with multiple local partners like our fire departments, police station, and OB department at the hospital. We are also partnered with Indiana Criminal Justice Institute to provide car seats for families that cannot afford them.
Okay, I did learn something today. Porter County really needs this.
You're right. We need your guys' help. If you can go to rothidtag.com and vote for Porter County Health Department so we can get 2,000 Roth ID tags to give to our community.
Vote for us, the Porter County Health Department.
Good. Awesome. Well done. Very good.
2 more seconds.
Can't help us.
You did that well.
He's kind of good at that.
Yeah, where's the star of the show?
Yeah, really.
Just give you a few stats on that video. We actually did really well, not in the contest, but the overall views and whatnot. So we reached 4,700 plus accounts. We had more than 7,000 different views. We had over 100 interactions, likes, saves, shares, and we had more than 3,500 people actually view it. So it didn't really translate to the contest.
Yes,
but
it did. There
And
were
we
a lot of
were
people
top-
in that contest across the nation.
Yeah, we were top 10.
You don't have to be number 1.
Did we win?
We won money.
Also,
That's the goal, though.
Yeah.
But we did really well on social.
They really did.
No, this.
It was fun to watch.
And like they had like a really good story
We did well. I mean, we
Yeah.
competed against people across the nation.
Yes.
Who won, Kendra?
Mountain Grove in Missouri, and they had a girl's mom was on there. She had passed away in a car accident and had her kids in the back, so like their family really could have benefited from having this tag on it. So she's kind of like made a commission to like do it for her county, and they did really well.
Awesome. It's a nice program that they did this for all of the people who participated. Very good.
And the last quick update I have is that the commissioners did approve us to use the building after hours for the heart scans the first Thursday of every month. So that is going to start happening January 8th. Will be
Oh, great.
so
For the Mac or the
Zach Mendo.
yeah.
Yeah.
they came last time.
Yep.
It was actually, I had a chance over the weekend to watch the meeting. And it was really nice how really overwhelmingly they were supported.
Yes.
You know, Councilman Vicks, over the building supervisor, he's like, you make sure that you
Right.
get this to happen. This is something that's really great for
It was very nice.
Councilman Vasquez spoke in support of the AEDs, so it was nice to see, you know, how much we're supported by our elected officials. Great job.
Thank you. You have anything? Then that would be it.
Dr. Guillemot, no, nothing to
I
add.
was covering for everybody.
Who are you?
Covering.
That's good.
Say what?
Good stuff.
I just made everybody else.
That's good. Delegation. All right. Any public comment? Then all in favor to adjourn, say aye.
Aye.
Aye. Record breaking.
Spoiler up, let's go.